Now, moving on to our third section that includes infective neuropathy. In this section, we will be going through those infections which specifically affect the different nerve roots or nerves actually. These include shingles or herpes zoster infection. Then we will be briefly going to the neurologic amyotrophic or acute brachial neuritis, which also can lead to usually an viral infection. Then we'll be briefly going to the Guillain-Barré syndrome and leprosy as well. Although GBS is a syndrome which is suspected to unknown, it's a syndrome of unknown etiology, but usually associated with viral infection, and it complicates after the child has undergoing a viral infection. And lastly, we'll be going through the mycobacterium, which lepri, which affects the nerves, leading to a known disorder called as leprosy. So, what are the infective neuropathies? These include herpes zoster shingles, neurological acute brachial neuritis, which may be associated with viral infections, GBS, which is also called as inflammatory demyelinating polyneuropathy, which is thought to be secondary to a complication of viral infection, and leprosy, which is caused by Mycobacterium leprae. So, herpes zoster or shingles, it's by varicella or chickenpox virus, or is also called as herpes zoster virus. This is usually normally it does not affect, but in case of immunocompromised, if in case old age people or those who are under stress, for example, they are taking steroids for any other disease, they may be infected with this virus. The classical symptom is severe unilateral pain and vesicular rash. The classical point is that it only affects single type of dermatome. Motor roots and cord are rarely affected. The only sensory part is actually affected. It usually results in the specific dermatome. It results in severe pain and tenderness. The treatment is symptomatic, that you have to give antiviral sometimes as well as painkiller and analgesics, so that these severe form of radiating pain is actually controlled. And we may have to give some kind of neuromodulators as well in form of gabapentin and pregabalin, so that because the dorsal nerve root ganglion is involved, so that actually results in decrease of the intensity of the symptoms. But there is no surgery which is required. Usually it's self-limiting and eventually settles down with this therapy. Now, another disease called as acute brachial neuritis, although it's a rare disease of brachial plexus, but it's thought to be secondary to some kind of viral infection, which is later on it presents as a complication in form of brachial plexus neuritis or inflammation of the nerves. Usually results in severe shoulder girdle pain and weakness. Why? Because the pain is due to neuritis, the inflammation of the nerves, and weakness is due to these nerves are all inflamed and cannot work properly. And because this brachial plexus mainly supplies the upper trunk or the upper limb and the shoulder girdle muscle, therefore almost all the movements are either restricted or highly painful. Parainfectious disorder, because it's said to be that there's initially some kind of a viral infection. Once that settles down, secondary to that, there's associated a complication of this viral infection is in the form of brachial neuritis. This is classically pseudo-mononeuropathic pattern, that is usually a single group of muscles, a single branch of it is mostly affected. As I just told you, it's mostly secondary to viral infection, which may be resulting in muscle weakness. If it affects the serratus anterior, which is also a muscle of this area, then this could be resulting in a medial winging of scapula. But if it affects the trapezius, which is actually on the middle side of the scapula, this may be resulting in a lateral winging of the scapula. So winging of scapula may be associated to acute brachial neuritis. As I just told you, it's a self-limiting, although there's a severe kind of a pain, so we have to be treated symptomatically. So for pain, we have to give analgesics, maybe initially a steroid shot may be required as well, along with the neuromodulator, so that the symptoms abate gradually. But overall, there's no kind of a surgery which is really required for acute brachial neuritis. Coming to GPS or Guillain-Barré syndrome, it is acute demyelinating motor and sensory, although mainly motor, called polyneuropathy. What actually happens is usually following upper respiratory or GIT infection, which is mostly viral in children. These children are born well, they are absolutely normal, they usually grow it, all their milestones are actually normal, but resulting in some kind of a chest or gut infection. Post chest gut infection, this results in classical pattern of ascending paralysis, that initially the lower limbs are weak and eventually then they become paralyzed, then the pelvic girdle, and eventually moving to trunk and upper limb. This kind of a pattern is usually seen with GPS. There may be aching and weakness due to neuropathy. There may be quadriplegia and respiratory failure. Sometimes the attack can be so acute that it may result eventually in a quadriplegia or respiratory failure. Usually associated as whole of the poly, it's a polyneuropathy, it's all sensory, motor, as well as the autonomic functions may also be lost, leading to features of autonomic dysfunction. And eventually, this GPS can be classically diagnosed by abnormal protein values in the CSF, because they usually, to properly diagnose, although there is history of classical history of infection is present, but to document, and this is a GPS, usually CSF analysis is done to confirm the diagnosis of GPS. Treatment. Initially, it's rest, and then pain relieving medication, because as it's a neuropathy, it involves severe form of pain. Then our IV immunoglobulins and plasmapheresis can also be done, and physiotherapy and splintage for joints, because if joints are painful, they can be splinted, so that once the pain is free, then physiotherapy can be started so that there's no associated contractures the joint become. Now coming to the leprosy, it's an old disease caused by Mycobacterium leprae, which is of the Mycobacteria family. We already have a Mycobacterium tuberculosis and leprae, and is causing two very typical diseases. Although now its incidence in Western world has actually decreased, it actually presents with multiple nervous symptoms and nervous lesions, for example, gomas and gangliomas, and then associated with skin conditions as well. And classically, it's called as joint fascies. That usually there's two types. It's called as possibacillary and multibacillary. Possibacillary, in which there's, if the gamma is sampled and taken for histopathology, it will usually very small amount of mycobacterium. But in multibacillary, there is a lot of mycobacterium present. As it involves the nerve, there is also associated loss of motor function. There may be trophic ulcers, eventually leading to osteomyelitis as well. The treatment is for the Mycobacterium leprae is actually multi-drug therapy regime. Usually rifampicin and dapsone is started, but other drugs which can be given is rifampicin, clofazimine, and dapsone for Mycobacterium leprae as well, in case if it's possibacillary or multibacillary. In this section, we have gone through the infections which actually infect the nerves as well. We have especially gone through the shingles, which is caused by varicella zoster virus, that is especially affects the dorsal root ganglion. Then we have briefly gone through those nerves syndrome called as GBS, in which the nerves are actually gets affected after a viral infection which is encountered by a child, usually following a respiratory or GIT. Then we have briefly gone through the disease called as leprosy, which also is actually the nerves are affected by Mycobacterium leprae. That's all from the section. Thank you very much.